Hello again and welcome back to part 2 of On the Line. I'm Christine Williams. Joining us now to talk about anti-aging is Dr. James Meschino. He's a fellow with the Academy of Anti-Aging Research. Dr. Meschino is also a chiropractor. Well, thank you for joining me once again.
Nice to see you again. Thank you.
Great information you always bring along, because when you talk about aging, you're talking not about all these creams that you see in stores, but you're talking from the inside out. Am I correct in saying so?
Largely that's true. I think the reason that I like to talk about anti-aging is because it gets people's attention. But the underlying agenda that I have for this is that the same processes inside our body that cause aging to occur, if you allow it to move at an accelerated rate, also lead to cancer, heart disease, dementia, osteoporosis, and degenerative diseases. The reality is that through nutrition, physical activity, and choosing the right nutritional supplements that are suited to your situation, you can, to a very large degree, slow down the rate at which your body ages. So you look better and you feel better. But more importantly to me, you're reducing your risk of degenerative illnesses that you may not have to face, that you would have faced otherwise. And I'm saying you can reduce the likelihood of arthritis developing, that the arteries narrowing and leading to heart disease and stroke, that your brain undergoes decline, that your bones demineralize and set you up for osteoporosis. You have much more control over those things than most people realize.
And there's a side effect, because you're also dealing with the issue of wrinkling, which is a very popular topic. In fact, The Wrinkle-Free Zone is one book that you also wrote.
I wrote The Wrinkle-Free Zone because I started lecturing to estheticians and plastic surgeons at different conferences to show them that nutrition from the inside out has a large role to play in the health of the skin and slowing down the rate of skin aging, and also that you can improve the softness and smoothness of your skin through the right nutrition and supplementation program. And they said, that's we had never seen that before. So they asked me to document all the evidence and put it into a book so they could give it to their clients. So that became The Wrinkle-Free Zone, Your Guide to Perfect Skin in 30 Days. That was the publisher's title. But it's a book that people should read because it gives a lot of the anti-aging information there as well. But there are a couple of topical things that if you put on your skin can help slow down skin aging as well. So to be fair to the cosmetic industry, there are a couple of things that are highly useful.
Does the alpha-hydroxy work?
The alpha-hydroxy acids, which cause this rapid turnover of cells on the skin, in the short term it works, but for daily use, I mean, you could use that periodically. For daily use, I like hydrexylin, which is a type of hyaluronic acid that puts back what your body no longer makes. Your skin makes hyaluronic acid. And what it does is it acts like a magnet and absorbs water from the bloodstream below, plumps the skin back up so that you don't have the volume loss in the skin. As you get older, you make less. So if you put the right kind of hyaluronic acid on your skin, you can put that back. The water magnet's there, plumps the skin back up to its normal full hydration capacity, fills in some of the lines and wrinkles. There's also another product called Matrixyl, which helps your body build collagen over your lifetime, which has a very pronounced anti-aging effect when you use the two of them in combination.
What about the role of genetics, Dr. Meschino? People that would say, well, my mother was all wrinkled by the time she was 30, so I'm destined to be there as well.
That's completely untrue. There may be a mild genetic component there, but primarily wrinkling and 75% of the rate at which you age is dictated by how you live your life, not by genetics. And that was established in the MacArthur Foundation study, studying twins, and saying that if they're raised apart, environmental factors have a greater influence on the rate of aging than does genetics. That's well established now in the medical literature.
What are some of the absolute no-nos when you want to keep young-looking skin and overall a young body?
The no-nos are eating a diet high in saturated fat, a lot of animal fats from red meats and pork products and high-fat dairy products, fried foods. Not eating enough of the foods that give you the antioxidants and protective nutrients. Not exercising sufficiently over your lifetime. Not getting enough protein to maintain your lean mass and the structural elements of your body. Insufficient amounts of calcium and vitamin D. What I've done to help people sort it out, they can read my books, but not everybody reads books. So health practitioners asked me to do this a while ago. They said, you know, if you could just come into my office and do the nutrition, lifestyle, anti-aging assessment on all my patients for me and tell me what to do, that'd be great. Well, I can't be everywhere. So I spent the last 2 years writing a computer software program. People can now go to naturalhealthtest.com and answer the 173 questions about themselves. Their age, their gender, signs of deficiencies, the dietary habits they have, their exercise behaviors, what medications they're taking, what health challenges they have presently, what things run in their family that they're afraid they may develop: prostate cancer, colon cancer, heart disease, Parkinson's disease. And after you fill that questionnaire out, you send it to us and it gets processed, and back comes my opinion. It says, look, if I were you, based on all this information, these are the dietary changes I would make, and here's the reason why. These are the exercise parameters I would work within. Here's why. These are the nutritional supplements you should consider. These are the dosages, the standardized grades, and this is the reason why. And these are things you should never do. You're on this medication, you should never do this. You have this health condition, you should never do this. This would be dangerous for you. For someone else, it'd be fabulous, but for you, it's the wrong thing. Most doctors don't have the time to go through the 173 questions with their patients in an office setting to actually get down to these points. So people go around guessing what to do.
Wow. Dr. Meschino, we have to go for a break now, but when we come back, Dr. Meschino is going to be talking about some of the supplements that you could be taking when it comes to anti-aging. He'll also be telling you why sometimes your body doesn't absorb those. We'll be back after this. Stay tuned.